You're having trouble walking or playing sports because of your Achilles tendons. They're swollen, they're painful, and they're stiff. Then you've come to the right place because I'll show you 2 exercises that can really help. What you need to know is, in my view, mistakes are often made when stretching, which leads to the problem dragging on and becoming truly chronic. You struggle with it for weeks and months. And that's why I'm showing you 2 exercises now, 2 for each side. So follow along, come on. Best to join in right now, which can really help you feel better quickly. For the first exercise, it's best to go to a wall so you can support yourself. And then, depending on the condition of your Achilles tendon or your calf, if you feel it pulling there, take a small step back first and tune into how much of a stretch you're already getting. You might even stay there if that already feels enough, but if you feel like you can handle a bit more tension, then adjust slightly and ease back into it. Please make sure that your foot is pointing straight and use your left knee as a kind of adjustment screw, bending it just slightly until you notice, exactly at the moment when it starts pulling in your calf or even right there in the Achilles tendon. Usually you will feel the stretch right in the calf of the leg you're stretching, but the Achilles tendon is still being relieved nonetheless, though. And then you go in further and further very carefully in a way that it's still just about bearable. It could be if your Achilles tendon is very, very sensitive, then you only go a little bit into the stretch. So it is always your body that guides you on how far into the stretch you should actually go. And now please focus your attention on the back foot, on the right forefoot, meaning the toes and the balls, and apply just a little bit of pressure downwards against the floor. But always check in with yourself to see if the intensity of the stretch somehow gets too strong. It should always be at a level you can just about bear. It still needs to feel positive. Then you relax once again and go just a little bit deeper into the stretch. And feel into it, especially if your Achilles tendon is very swollen maybe and hurts intensely, then small movements are often enough, but don't have any worries, because if you stay in the range where it still feels good, where it's still a good pain, then your body likes it and you will be rewarded straight away. Then you slowly ease out again, always moving out nice and slow. And now feel inside to see if you feel some relief already. And then we'll do the same on the other side. Step back with your left foot. And first just feel, how much do I notice there already? And it is good if you step back far enough with your foot that you can already feel a slight to an even more distinct sense of tension there. And from there, you can then start off and go even deeper into the stretch and feel very precisely. Is it still a good pain? Positive? Can I breathe quite calmly? Because it shouldn't hurt so much that you just want to get out, as that really ruins the fun and you won't be able to stay in long enough, because we need these plus or minus 2 minutes to obtain a really good result. Keep on breathing. Always make sure that your knee is fully straight. If you're ever not quite sure if it's straight or not, then back off a bit and stretch it out once again. Then you will probably feel it once again, and then you slowly ease back in and you continue stretching. Keep feeling into it. Is it still quite bearable? And now put pressure on the balls of your feet and on your toes, as if you wanted to go on your tiptoes. Just enough so that it all stays positive. Relax again, let it go and move deeper into the stretch. Once you notice, that the stretch is starting to increase once more and it is enough, then just stay in that position and press your forefoot against the floor once again. Hold that position for a moment. Relax and go even further into it, and make sure that your knee stays fully extended. Then slowly ease out and now feel right into both Achilles tendons and into both calves. It could also be that you notice a change in your knee. Many people stretch exactly what they just did in the first exercise. That's also good because it already takes pressure off the calf and thus the Achilles tendon, as it's a connection between the calf muscle and the heel. That's where it's attached, so to speak, but there's a second exercise that's almost never done. And the difference with this is that we are not stretching with a straight leg now, but rather with a bent leg instead, you see. The underlying reason for this is that this deep-seated muscle does not run across the knee, but instead it actually ends right here. So it is usually not even stretched at all when the leg is in a truly straight position, and we're stretching that specifically now. Then you'll notice right away how the effect is different and much, much more noticeable. Go ahead and use a chair for support like this, so that you are a bit more stabilized. Step your right leg back a bit, and now bend your right knee. Left one follows a bit too. And please try to do this. Take a look down at yourself, and then you'll see your thigh. It should be as vertical as possible, and your torso should continue straight up from there. And feel into it again, how deep you can go, and don't be alarmed, because this stretch usually pulls right into the Achilles tendon and into the ankle. That feels completely different, but that's why it's also the perfect complement. And then you let your knee sink further and further down little by little, gradually closing the angle between your shin and the upper part of your foot. And then you will start to feel the stretch down at the Achilles tendon and right into your ankle joint. And you stand quite still and keep going a little bit deeper. If you notice that your right thigh is straining too much, that's because you're too far back. Then you just move forward a bit, shift a little onto the left leg, and then you'll notice, here it's relieved, and I can go even deeper into the stretch. Always feel your way in, like with the exercise before. Is it already too much, or is it still a good kind of pain? Breathe. That can help you relax and let go. And now, try to press down against the floor with your forefoot here as well, as if you wanted to go up on your toes. Only do it as hard as it still feels comfortable. The important thing is to find that limit where it's still a good kind of pain. That is how you get the best effect. Then you just let go again, and normally you will be able to go a little bit further into the stretch. That is indeed possible then. Then press your forefoot against the floor once again. And keep holding that tension, because now we are strengthening the muscle within the stretch. And that really works out particularly well. And now just relax once again and go down just a little bit further than you did before. And watch out as you are coming out now. Move nice and slowly. It is best to shift your weight onto your left leg and then pull the right one further forward. And move it around a bit. Notice the difference from before. Now let's do the same thing again on the other side. Take a step back with your left foot. Make sure your foot points forward and doesn't turn outward. The back foot must point forward. And now bring your thigh back to a vertical position. And keep your torso vertical over your thigh. And then you can really make use of your body weight in order to trigger the stretch properly. And here again, you will feel the stretch in your Achilles tendon, in the area of the ankle joint, so down here. And we will wait for that for a moment until the muscles and fascia give way nicely, adjust it exactly so that it is still just about bearable for you. Breathe it in. And then also test here very carefully, depending on how your Achilles tendon feels, and push down with your forefoot against the floor. Hold that position for a brief moment, let it relax once again, and go just a little bit deeper into that right-sided squat. Bend your knee just a little bit more, then you will feel the stretch in your Achilles tendon increase further. Go to the spot where you feel it's still just negative. If I were to keep going further, then it wouldn't be negative anymore. You need to pinpoint this exact spot and push against the floor again. and relax once more. And go a little bit deeper. Keep breathing nicely, keep feeling into it. Is it still manageable for you? And then very slowly shift your body weight onto your front foot. Take the pressure off your back leg, pull your foot in and move it around a bit. Place the foot down a little bit and really feel into it there. It's quite possible you already notice a clear difference after the first exercise and even more so after the second. Look, I want to show you this on our knee hero. There you can do both exercises with a straight knee, like now, or also with your knee bent. Like doing it now during pre-stretch. If you don't have the knee hero yet, you can also place 2 books underneath and then the stretch will be much more intense. And now it's important to do this every single day, 6 times a week. So save this video and join in every day, and then you will notice how you are making progress each and every day.